Hello, everyone. Welcome to today's presentation. We still have a few people who are joining in, so we'll give a few minutes. My name is Reena Banerjee. This is my name sign. I work for the Arizona Commission for the Deaf and the Hard of Hearing as their community engagement coordinator. I'm thrilled to be here today and so grateful to host this important webinar about FEMA's continuing efforts to promote accessibility with disaster preparedness for the deaf, hard of hearing, and deafblind communities. We are absolutely honored to have Aaron Kubey with us today. Thanks for being here, Aaron. He brings a wealth of knowledge and experience to accessible disaster preparedness. And I know that Aaron's going to talk a little bit more about his background and what's important to consider with accessibility for the deaf, hard of hearing, and deafblind communities when we are thinking about disaster response. We are going to start with a few ground rules. So Aaron is going to be presenting. We do have a way for you to ask questions in the Q&A chat. We'll be responding to those questions at the end of the presentation. So feel free to take some time to percolate on the kinds of questions that you want to ask, and you can put your questions in the Q&A button at any time. All right, so Aaron, thank you so much for joining us today. Would you like to go ahead and introduce yourself?
All right, part of my introduction includes the opening slide. Can you go ahead and show that now? And while she's doing that, I want to mention that if, for those of you who are deafblind, I'm a white man and wearing dark clothes, and I have got short hair, and I've got a white background. I'm wearing a dark black shirt with sleeves. All right, can you go ahead and advance this slide, please? I want to give you a little bit about my background. I was born and raised in Chicago, where I am now. I'm taking care of some family right now. I was born and raised in Chicago. And I ended up much later in DC, and became a certified deaf interpreter in 2015. And I also got involved with FEMA, very involved in 2016 as a reservist. And in 2016, my first crisis was in Baton Rouge, Louisiana, in the fall of 2016. And then I became a full-time employee in January of 2016. I just celebrated 8 years full-time. I do have a joke where I say the years that you work at FEMA is equal to dog years. There's a lot of work involved, and it's very exhausting, but it's very satisfying as well. And I started as a certified deaf interpreter, a CDI, and then I moved up over time to a second level position as a communication access specialist. I still work as a CDI, but I'm really focused on communication access at FEMA. And the goal is to make sure we're providing effective communication for deaf and hard of hearing and the deaf-blind community. And we advise on various policies, best practice, and the process of providing communication access for those communities. Providing training for disasters, FEMA staff, collaborating with local organizations, interpreting agencies, contracting with local interpreting agencies and various agencies local in order to collaborate to also conduct various events for disaster preparedness. There are various programs in the agency, and I instruct them on the best ways to provide effective communication and interaction with the deaf community, with the communities. For big disasters such as hurricanes, we have an administrator, but there are also many other players involved and programs involved. Part of protection, transportation, Red Cross, and I usually will be interpreting for a lot of these the informationals that are given out, these press conferences and trainings. I go to various events, city halls, and the like. I also advise on why it's important to have an interpreter in the line of sight of the speaker, presenter, and we've made a lot of progress in that space. It's very important to provide that equal access to the communities. When I started in 2016, actually 2017, it started with Harvey and Yuma, sorry, Hurricane Harvey and Irma, and then there was Maria. We had noticed that at the time there was not a lot of interpreting video access. There was captioning and voice, or different issues, subjects such as registration, registering, or different programs for individual supports and safety. So we collaborated with the CDC and partnered with the USDA agriculture section and USMC, the Army Corps of Engineers, in order to provide information in ASL and print and voice modes. And I'll go over more of that later. So my background is really, it started in the theater, and then it went to interpreting, and then now to emergency management. And I really love what I'm doing now. And the reason is because, I grew up with a deaf family, deaf community, deaf culture. And in high school at MSSD and Gallaudet in Washington, D.C., I had noticed a lot of various things, such as lack of communication in emergency management and how many people didn't know what to do in those cases. It was life and death situations. So we needed to make sure communication access was there. So I assisted and taught how to improve the process and to make sure that information was readily available. So I want to talk about what my responsibilities are in FEMA and what emergency management entails, and the process from start to finish, from a disaster to the declaration of an emergency and all the way to the end. Okay. So I'm not just a one-man army. You are also involved in this process. You also have a responsibility, and I will talk about that towards the end. All right, can you forward the slide, please? All right. There will be a video here. This will turn into a video. This video, there is some music in the background, but it's visual in nature, and it will explain the process. Can we go ahead and play that video now? All right, and the next slide will start another video, so let's not do that just yet. All right, so to encapsulate what the video was conveying, so when a disaster happens, start to finish, it really must involve the local level. At the local level, it could be a hurricane, a flood, or mudslide, or earthquake, hurricane, what have you. It's a disaster, and at the local level, the resources, fire, police, financial, they tend to be overwhelmed and they cannot do everything on their own. So they reach out to the county, to the municipalities, the village, the parish. Various states have their own municipalities. And then so they go to the county level, and if they're overwhelmed, they usually reach out to the state. And then the state usually is overwhelmed. What they do is they do a damage assessment, though, and figure out how much money is going to be required, how many people are affected, how many homes, and how many roads and bridges, hospitals, and the like, and come up with the value, an estimate. There are two different buckets of assistance: individual support, that is for homeowners, renters, and then there's the public assistance, the PA. The first is called individual IA, the other is PA, and that's regards infrastructure, again, hospitals, fire, first responders, schools, parks, roads, bridges, and the like. So they'll assess that. Congress will establish a threshold that has to be met. And if they meet the threshold, then they can submit to the governor. The governor then has to make a request from FEMA. And once we get that request, we go to our upper manager and get either an approval or denial. And then we submit that to the Department of Homeland Security, the Secretary of DHS. They'll sign off or deny. And if they do sign off, then it goes to the president's office at the White House for the final signature. And until the president signs off, we cannot do anything. Once we get that authorization, then it becomes a presidential declaration, or it's called an MDD, a major disaster declaration. And that allows us to implement the full program with the state and to interact with the state and help with state and local needs and recovery and the allocation of funds. And it's a very complicated process. The other thing that I want to emphasize that is very important, we are a government agency and we coordinate with other partners, government agencies, private business, nonprofits, and the like. We have now what's called a lifeline. I call it support lines, or I sign it that way. Transportation. It involves transportation, food, water, health, shelter, electrical, let's see, hazardous materials. There's 8 different categories, and each one of those has a different government agency that is responsible. For example, with communications, that's the FCC who would be leading that charge. They would be responsible for communications and working with the various stakeholders, the telecom companies, phone companies, Verizon, AT&T, and the like. They would reach out to them to make sure that the phone service is functional and the internet service is functional. Then there's Health and Human Services, HHS, who is responsible for their wheelhouse, hospitals, and the like, nursing homes. Then there's Transportation, part of the Transportation Agency, and the like. So we coordinate with all those players, and I'd like to compare it to, we are sort of the parent of those. They're like our children, if you will. They're like, grandchildren, niece and nephews and such, make sure they're behaving and doing the right thing and coordinating, working together, partnering, and communicating with each other. So it's not just FEMA, it's a large group of players that are involved from the federal level down to the local level. So again, I want to emphasize that we are a government agency, but when there is a disaster and there's a declaration, we are invited by the states. We must be invited first before we can go in and do our work. That is by law. And we cannot just go in and start making orders, giving orders. And conversely, the state, the state tells us what they need, and we do what they need. We provide government funds. We have government requirements for federal funds, but we do comply with the state and work with the state, county, local levels and their officials and regarding what they need and want, because they know their communities better. They know what their constituents need, and every state is different and unique. They have their own preferences, needs, and requirements, and so we comply with that. When the time comes, when the disaster has subsided, the states will usually let us know that they can take it from there, and then we must leave. At that point, we can't linger and stay and say, but we want to stay and we want to continue to provide support. That would be rude, especially when you're invited. Just like when you have company over, when they ask you to leave, you politely leave. So we do the same. But if there's still a disaster and they ask us to leave, then we comply with that. So oftentimes people wonder why FEMA has left. It's because of the local, state government, local governments who have asked us to leave, and we comply with their wishes. All right, please advance the slide.
Now, what exactly does effective communication mean from the perspective of emergency management? Of course, we want to see ASL interpreters that are in the frame of the shot for any kind of press briefing or news conference. That is very important. We always prefer to have a CDI, a certified deaf interpreter, because they are native language users and can accommodate the language needs of the people watching that information. We really encourage plain language that would be understood by a layperson, simplistic terms when providing messaging for emergencies. We want to make sure that all of that language is easily understood for everyone involved. Now, of course, as an ASL interpreter, I'm going to add that conceptual language needs to be included, not just simple language, because simple language isn't always accessible for deaf, hard of hearing, and deafblind individuals. We want to make sure to use language that is not only at a third, fourth, fifth grade level, but also language that paints a picture, essentially, so people can really envision what is being communicated and be able to apply whatever they need. We want to make sure that the community understands clearly and effectively. The average hearing American reads and writes at a fifth or sixth grade level. The average deaf, hard of hearing, and deaf-blind American is typically at a third or fourth grade reading level. And then there is a large part of the population where English may not be their first language. They may have limited English proficiency, maybe due to a developmental delay, an intellectual disability, or a person from another country. So we're dealing with people who have a great spectrum of understanding for English literacy. Oftentimes, what we hear from the community is that messaging is put out, but it's too technical. It uses terms that only emergency managers understand. So we work really hard with our partners to make sure that the language that's being put out is at the level that everyone will understand. Now, that doesn't mean dumbing down the language. It means meeting the community where they are, providing them with what they need to fully understand that message. We want to accommodate them rather than the community trying to accommodate us. We are encouraging our partners, and us here at FEMA internally are using more infographics to communicate information. Previously, you may have seen someone just talking about the information on a press conference, or maybe even having an interpreter there in picture. But now, if we can use infographics, if we can show pictures to give a real in-depth understanding of that material, that helps the message be clarified for all individuals. And of course, all of our videos, we are working on captioning and including voiceovers, as well as the ASL that is being produced on the screen. We also will provide signed materials for the sign language that's used in that area. So for example, if we are working with a disaster in Puerto Rico, we're going to use the sign language that is used by deaf individuals in Puerto Rico. We're going to have Spanish instructions and information shared in Spanish to make sure that all of the languages are met for this information. Now, how FEMA provides effective communication, we've got a few different examples. Of course, FEMA always tries to provide an ASL interpreter for a national level press conference. We make sure to get with whoever is coordinating that press conference to make sure that the framing of the camera is going to include the interpreter, and make sure that that is the case for all of the networks that are streaming that press conference. Anytime there's any kind of event, like a town hall or a recovery center, we make sure that there is sign language interpreting and other kind of accessibility features available at that site. If a disaster happens and an individual isn't sure how to register for the help that they need, if they don't have the kind of equipment that they need for that registration, we have several organizations that we partner with that take care of the business admin side of a disaster. They can help individuals register for any of the programs and services that we offer. We also work closely with nonprofit organizations like the Salvation Army and the Red Cross, and many faith-based organizations as well. If there is a state organization that is providing services, we will absolutely provide support, such as VRI. We will provide laptops or tablets so that any individual can connect to VRI. We have a DEA team whose sole responsibility it is to make sure that all of the programs and services and the needs of the community are being provided in accessible ways. They share information, they knock on doors. They are essentially our eyes and ears, our boots on the ground, to let us know what a particular community needs after a federal level disaster. They'll let us know if there is a concentration of a deafblind community in one place or a hard of hearing community in one place. They will let us know so that we can make sure that we're prepared with the kind of accessibility features that are needed. And of course, if a deaf or hard of hearing individual comes into one of our disaster recovery centers, we aim to have interpreters to be with them throughout the entire process. Now, do all of FEMA's videos have ASL access? Not quite yet. That is our goal. We absolutely have to have captions and voiceover. That is something that's required, but we are working toward getting ASL interpretation on all of our videos. And of course, we're developing new material with more of those infographics so that more people can better understand the information that the emergency information that's being shared. Now, there is a new program called the Deaf and Hard of Hearing Accessible Communication Survivor Support Helpline. That is a program that we are developing, and I'll tell you a little bit about that now. We're going to go over the 5 WH questions about ACSSH: the what, the who, the why, the where, and the when. ACSSH stands for the Accessible Communication Survivor Support Helpline. The people who will benefit from this program, we'll talk about the why this is necessary, where to find this program, and when we will launch it. Next slide, please. So first, a little about ACSSH. This program is designed to deploy a new software that allows people to contact FEMA directly through video. What we want to avoid is people having to rely on the video relay service, which can be a huge burden for another federal agency, the FCC, that runs the video relay service. The agent that answers that call will be deaf or hard of hearing themselves, or be an interpreter, an ASL interpreter. Our goal is to have a way for deaf and hard of hearing individuals to have direct communication with FEMA employees to get the information that they need. We also have other technology that helps people who are speech disabled or have other communication disabilities. Now, for any emergency, FEMA offers a 1-800 number, a toll-free number, where hearing people obviously can call and ask any of their questions about registering for programs and services, applying for those programs and services. And of course, for hearing people, that 800 number works great. For the deaf, hard of hearing, and deafblind communities, we are now going to have a separate number interpreter error. The current process is that the deaf, hard of hearing, and deafblind communities have to call through a third-party service, like the video relay service. Sometimes our staff doesn't realize that they're on a video relay call, and there are some staff that don't understand that we can accept those calls through third-party services. So sometimes deaf and hard of hearing individuals will be hung up on. Hang on one moment while we switch the interpreters.
All right, so we'll let them know that you cannot hang up on VRS calls, VRS users. So if I'm a deaf survivor and I'm impacted by a disaster, hurricane, fire, tornado. I've lost my home, let's say. My family and friends are gone. And all my things are gone. And the only thing I have is what I'm wearing. Everything's been destroyed. That takes a toll. And there's a lot of trauma involved. Now I've got to register. I've got to work through an interpreter. I'm asked all these questions. There may be misunderstandings. A lot of times, VRS interpreters are taking a cold call and they don't know all the background and don't know all the terms and don't always interpret accurately. So that's another issue to deal with. I'm not trying to be negative about hearing interpreters, but a lot of times that is a pain point. So it can be very frustrating. Next slide, please. ACSSH uses DVC. It uses DVC, direct video communication. ACSSH has a website that will have the information, the phone number to call, and it will recognize that it's a video call and be routed to a deaf employee, caller assistant, and I can communicate directly with that person in sign language. It is so seamless, so clear. And I don't have to adjust how I'm communicating because this person knows deaf culture, knows ASL. And so in those disastrous moments, it's very comforting in order to have that kind of access and to have this feature. It's a brand new thing that we've started, and it's very, very welcomed. Next slide, please. All right, who will benefit from this program? Well, honestly, everyone. Deaf people, hard of hearing individuals, deaf blind individuals, survivors. They'll be able to communicate directly and have that communication access instead of involving a third party with all the complications that entails. We're going through piloting testing right now, and pretty soon we'll be doing some internal testing and then a public testing. We've already made sure that we include input from deaf and hard of hearing individuals, community, and captioners and deaf blind individuals to make sure that we are in compliance with 508 and make sure that it's accessible to everyone. Next slide, please. Why is ACSHH necessary? Because as I just explained, especially in these traumatic experiences, individuals can communicate in their primary language. The goal is to make sure that there's equity in this process and that we provide effective communication. Our goal is to always improve how we provide support to the deaf and hard of hearing and deaf blind communities. And we're hoping that ACSSH is one way to improve the communication access. We're going to coordinate in order to improve the process and speed it up. Next slide, please. Where will ACSSH be available? At the Disaster Recovery Center, they will tell you where to access ACSSH. You can, it's not a physical location necessarily. You can access it on your phone, your iPad, your laptop. This is a website-based program, so you can put it in the video phone number, your video phone, or through VRS, and you'll be able to access someone to support you. Our goal is to have one laptop for ACSSH. When there's a disaster and you go to one of the recovery centers, you can use a laptop, one laptop, to access that helpline and get that support. Next slide, please. When will this be online? The hope and the goal is this summer. We were hoping that would be ready, but we still have some technical tests and things to work through. All we know is that it's going to be launched soon. We'll do an internal testing and then a public testing. And then if there are no bugs and we've gone through all the feedback and everyone is satisfied with the product, then we will launch it. And we're going to do a very big marketing campaign to inform the public. We are talking with our various teams, Deaf News, the mainstream media, to get the word out, to make sure that everyone's informed about this service and this program. The hope is it's going to be launched this summer. Okay. Next slide, please. All right. And once this program is launched, we hope that you will also help spread the word. And that way, when individuals are hit with a disaster or an emergency in various parts of the country, they'll be aware of this resource, okay, and they can take advantage of it. Next slide, please. Like I mentioned before, we are not a one-man show. We work with so many other players and agencies. We can't possibly know everything that's going on at the local level, the state level, so we can't assume that one size fits all. Every survivor has a unique experience. There are some things that may be similar, but everyone is unique. Everyone has a unique experience, and so we want to honor that. Your needs may be different from someone else, so we really want to encourage everyone, local people, to contact your local supervisors, your county emergency managers, your state emergency managers, and let them know that I am deaf, I'm hard of hearing or deafblind, or I have some other disability. Let them know about your situation and where you live, what area. If you know of others, let them know about those individuals as well. And get the word out, because oftentimes they don't know about our communities. And if they don't know where you are or what your local needs are, then they can't be of a resource or help. And so you can't get upset or pissed off if they don't know how to help or know where you are. So help them to help you all, okay? Let them know, reach out to them, communicate. And also by letting authorities know that you're deaf or hard of hearing or deafblind or have some other disability, you can also let them know that you would like to help out in emergency planning or various programs or initiatives, and to include you. That way you could be a subject matter expert and contribute that way. Offer advice so that they could improve their accessibility. If you notice various gaps, you can point those out. Let us know. Oftentimes, they will release hard copy, and it's just in English. But you can let them know that it's very important to have those translated into ASL and the reasons why it's very important. Help them to understand your needs. And the more that you partner with them, with FEMA and your local authorities, the smoother, the more streamlined things will be going forward. So when a disaster happens, it shouldn't be so destructive. Everyone will know who's responsible, who's the point person for various roles and tasks, okay? There is what's called CERT, Community Emergency Response Team. Oftentimes, hearing individuals may not know anything about deaf culture, hard of hearing individuals, culture, and deaf-blind, the communities. So if you become a CERT individual, you become sort of a lead during disasters, and you can lead your communities in provision of information, resources, and general support. I implore that ACDHH, they have a program what's called ERIC, right? And I forget what that acronym stands for, but I'll let them cover that. But I really encourage you all to work with the commission and to work with your local first responders, administrators, and become more active, be more involved, because you have power too. Work with them, partner with them, because we cannot do it all. We can do it as a group, as a collective. Next slide, please. So again, as I was just saying, the whole community approach is imperative. We can't do it all. We need you all and your support. We need a lot of partners in order to make a team, in order to be more effective in disaster response. A lot of times people will say, well, the government will take care of it. That's their job. But no, we need your help too. Nonprofits help us and we communicate with them. We know that they're nonprofits, but oftentimes we will encourage individual citizens to reach out to them. If there are certain things that they cannot do, then they will refer to us. And we all, as a synergistic sort of approach, we don't often know what the local community needs. We have a general idea, but each community is different and unique. And so we want to make sure that we are serving our communities and that we're working together as a whole community approach. Deaf and hard of hearing, deaf blind, or any individuals with disabilities, and making sure that we're all engaged in that process to make it work. Next slide, please. All right, so that is the overview of my presentation. I hope that that was meaningful for you and that you learned something, or it helped you to recall some things that you learned in the past. And these various things we talked about are actionable. So my email address is aaron.kubey@fema.dhs.gov. If you can't remember, then Reena will be happy to give you my contact information. And I'm here for you. And with that, I'd like to open it up for questions and answers.
Hello, thank you, Aaron. Thank you so much for that wonderful presentation. We do have a few questions in the Q&A so far. One person said, ACSSH is new to me. Will that service include voice and captioning for the hard of hearing community?
Yes, ACSSH is new for everyone. It hasn't been launched yet. We are just putting the word out so that everyone is in anticipation of the rollout. I've mentioned this before. We've got an 800 number, 800-621-3362. That's for anyone to call and register or to follow up with the application process. Again, that's a general number, a hearing number. But ACSSH is an ASL language line that's equivalent to the 800 number I just gave you. ACSSH program, again, is website-based, or it's web-based. You would put in your VP number or your caption relay number, and then it will be routed from that point to the appropriate number. If it recognizes it as a video phone number, it will route you to a person who uses sign language, and they will be able to help you. The program has a caption feature. You can click the button and see the individual there on your screen, and then captioning below, okay? I'm thinking that later that the captioning feature can be converted to various languages. I know that the FCC, the VC program, it can be translated to 16 different languages at this time. We want to make sure that that's compatible. We know that not everyone speaks English and Spanish, those more popular languages, but survivors may have hearing loss. They may not speak English. They may speak Russian, French, Chinese. and the like, Portuguese. So they need to have access as well. And so that is our mission. This is a brand new program, first of its kind in history. And I'm very glad that FEMA is committed to providing direct communication for the deaf and hard of hearing, deaf, blind, disabled survivors, communities. When we first launched this program, there may be some hiccups, and we anticipate that. So any feedback you may have that can help us to improve our process is welcome. We're always trying to come up with ways to provide better service. So please give us feedback, help us to help you regarding communication access. There may be things, some blind spots that we have not anticipated. So we welcome your feedback. Our goal is to make sure that we are accessible to everyone, to all survivors.
Absolutely. Thank you for that. Another question that I had, what are some challenges that you've faced as a deaf person in emergency management?
Well, that's a very good question. Oftentimes, we will see people expressing disbelief at the need for interpreters. Well, it's very important to provide language so that the messaging is clear, especially in these times of emergencies. We want everyone to fully understand what is happening because it's a life or death situation. And we are responsible for your lives. And if someone dies in that case, will you be able to sleep at night because you didn't make sure that effective communication was taking place? I couldn't. So as they say, you don't know what you don't know, right? And so typically they tend to be ignorant or make assumptions until they see with their own eyes, or we paint the picture for them so that they can see those pain points. Oftentimes, they may have some superficial rundown of what is happening or the pain points, but until they fully understand what's going on, there usually is no buy-in. Oftentimes, officials think that they know what we need until we explain that, look, my first language is ASL. My community is a deaf community. I know what we need. I know the gaps, and I'm happy to provide feedback so that you can help the community. I'm helping you look good. So, but oftentimes there is pushback. So what happens inevitably later is they come back and say, you know what, we actually need your feedback. We need your input. So those are some of the challenges, really trying to break through and to make sure that individuals know what we need and the importance of it, because we get that pushback oftentimes. But a lot of times what we do is just try to turn the tables and help them understand, how would you feel if you were the only person that was hearing and everybody was deaf? Well, that's the world that a lot of us live in. And it really helps them to understand and to have that empathy.
Absolutely. Another question I'm seeing, is there any staffing needs for the new program? Are the people who are answering the phones volunteers? And what kind of training do they receive?
Yes, ACDHH has already hired a team of 16 individuals so far. 13 are deaf and hard of hearing, and 3 are interpreters. There's ASL and LSPR, and we have 3 call centers that have dedicated phone lines in Hyattsville, Maryland. It's just outside DC. And then there's Denton, Texas, just north of Dallas, and then one in Puerto Rico. And they are hiring and training for the call centers. Our software has various questions that are asked. As government employees, we're required to ask those questions exactly as they appear, verbatim. so that way it's standardized. There's in ASL and LSPR, there's different ways to sign those questions, and that's fine, but is the main thrust is that they are conceptually accurate. And we teach the individuals how to sign those questions, customer service, how to address various caller needs, and a variety of different areas. The staff have been hired about a year and a half ago. The program continues to be developed. It's been about 4 or 5 years now launching this, standing up this program. And there's a lot of technical issues or components involved. It's very complicated. I'm not going to bore you with that, but there's deep training on the FEMA requirements, just like the hearing staff that FEMA employs, but we have to train staff on the software, the features, the programs, the questions, the appropriate gloss, sign language gloss as far as the questions go. So it's quite involved. Our goal is to scale this program, and as the word gets out and it becomes popular, then we will definitely make sure that we advertise openings as they become available. But right now we have a small staff.
That's a great plan. Really looking forward to seeing how all of that turns out. I'm seeing another question in the Q&A asking if you work with other national organizations like Red Cross or other local organizations to provide disaster support.
Yes, again, the FEMA is a coordinating agency, so we're responsible to partner with a wide variety of government agencies and state organizations and agencies, county level, local level, nonprofits. We do work with private businesses such as Walmart, Lowe's, Home Depot, food stores, supermarkets, etc. And so that we can provide what is needed when called upon. Emergency management seems simple, but there are so many layers as far as what is needed, logistics, how to provide, to procure and coordinate. There's various agencies, nonprofits such as Salvation Army. There's mental health organizations. That's a big emphasis these days, is mental health. And we're always trying to develop new partnerships and to look for any blind spots. Have we not partnered with anybody? Is there certain organizations we want to partner with? Certain organizations that we can partner with to provide more access. So we're always brainstorming and working on that. The Red Cross is one of the biggest organizations we work with, and the Salvation Army, but mostly we worked with the Red Cross and they've been instrumental. The Red Cross is responsible for providing shelters. If people have nowhere to stay, they've lost their homes, then Red Cross opens up their shelters and provides that for constituents. Also, we work with first responders, and they also provide food, water, clothing, formula, diapers, a whole host of things. But I'd like to emphasize, because they're nonprofits, they can provide these reliefs a lot faster. But nonprofits do have a certain limit because they're nonprofits. The government has more resources, but because we're a government agency, there's a lot of red tape and requirements that we must comply with. And that is something that people don't like, but we're trying to protect the taxpayer dollars and make sure they're being used appropriately. So it's inescapable. Again, Congress has established limits that we can apply for relief. I think every year they tend to change the number, the amounts. Last year, the limit was $47,500. And that is why we are urging individuals when there's a disaster to have insurance and to file with your insurance companies immediately. You can still file with us as well, FEMA. We welcome that, but the insurance money usually is a lot more than what we can provide. Nonprofits can also sometimes provide a financial relief or support, but we can support almost everyone anywhere.
Now, do you work with deaf organizations as well?
Yes, we're working more and more with deaf organizations. It's part of my wheelhouse when I go to various disasters and emergencies. When I arrive on the scene, I try to reach out. Let me back up just a little bit, actually. I know quite a few people from just about every state, so I usually will contact those key people in order to network so that I can get information on what's going on the ground, so that I can be referred to local organizations or key people. I reach out to those individuals and let them know that we just declared your state an emergency and I'll be coming to your location. It's my responsibility to coordinate with the community, deaf, hard of hearing, deaf blind communities, that I need your help because the people, what's going on the ground. I know FEMA, I know my program, but we need to work together closely. And we will coordinate a deaf, hard of hearing, deaf blind event. So they let me know where the facility will be at, the time and date, and get the word out. And I will bring the FEMA program and various partners and talk about how we can provide support and services. And at that event, there will be a team there to help individuals with registering for support. Recently in North Carolina for Helene and Milton, we sent several team members from ACDHH to those locations, both teams of 5, and interfacing with the locals there, hosting events like that to do the same thing. So that way there's direct communication. We provide individuals who are authorized, who could sign to work with them, because I can't do everything. I need the local organizations. I need the state organizations. I need you all literally to help us to help them. Okay.
Wonderful. Thank you. So, are you going to be encouraging states to have specific disaster recovery centers in each state that, is there a specific location that will be decided?
Both. A year ago, we sent a team to Rhode Island. There was flooding there, and we partnered with the Rhode Island School for the Deaf. I introduced them to connect with the Rhode Island Emergency Management Organization. Before that, they weren't really communicating. And going forward, they were able to coordinate disaster relief. So the Rhode Island School for the Deaf wants to be a sort of central place where people can go to get help, a one-stop, if you will. So what happened is they established an MOU and they are working together now. So if there's an area that you know of where there's a large deaf community, you want to have a central place where everyone can go to get the information they need and can communicate freely. And to have that access instead of going to somewhere where you're just the odd man out and don't have communication access. So if that's possible, I strongly encourage that communities, states, counties, local government, figure out what is best for your area. I cannot dictate that. I can be of a support, But it's really your decision at the local level, how you want to do that.
Understood. Understood. Now, what do you find is the most rewarding about your work? What are you inspired by?
I've got a few different examples. One example I remember is during Hurricane Ian in Florida, partnered with the deaf church there, and there was a big group that was gathered together. It was in Naples. So Naples, Florida. We put out the word and got a group of about 70 deaf community members there, and about 40 of them registered for disaster relief. One man approached me. There were some tables established. He was busy, so I waited till he was done, but I would say he was about 60 years old. And he said, I'd never heard of FEMA before. I'd never knew that there was disaster relief, help, and support, that the state could provide some relief. I've been through 9 disasters and I've come out of pocket for every one of those disasters each time. And it really hit me. Disaster relief or coming out of disasters are expensive. So we were able to help him, and he was able to get the help he needed and assistance. And he was so thankful, so grateful. He realized that he didn't have to go through all this alone again and go through all the trauma and suffer through it. He was so thankful. And that really touched me, really hit me. And most recently for Hurricane Helene in North Carolina, there were 2 different survivors. There was a deaf couple who was taking care of the husband's mother, who has some health issues, and lived with her sister, who also had health problems. And they didn't know that there was help for them. So we coordinated, getting help for them and the type of help they needed. So we went to the disaster relief center, and I interpreted for them, and they were so thankful that they were able to understand everything so clearly, and how our staff streamlined everything for them. And the family was able to recover very quickly and get everything worked out. The second survivor is a hard of hearing individual, worked for a state agency, deaf and hard of hearing program in Asheville. So after the inspections were done, the inspector left. I stayed with the individual. I always want to make sure that I talk with the survivor. They were very thankful, and I asked, how are you doing? How are you? And they said, all these different things, right? I said, wait, hold on, but how are you? And they said that I'm just exhausted. I'm flattened out. I'm traumatized. I said, well, that's why, we want to ask them, because oftentimes we put on a mask. We just try to get through things, but you're not doing good, right? So you have that lack of communication, and you don't know what's happening. You're left in the lurch, and so you're exhausted mentally and physically, and it takes a toll on mental health. And so I told the person that, because they had just gone through one of the worst days of their lives, and it was a very horrible experience for this person. And I just made it clear that I'm sorry that this happened, but I want to tell you that it's important to take one day at a time. Take one baby step at a time, and don't try to look into the future or obsess on your problems at the moment, but that you will get through it. You will recover. It will be a struggle. Some days will be great and everything will go your way. Other times it will be infuriating and upsetting, but it's okay to process that, to feel those feelings. And I promise you, though, in the end, At the end of your recovery journey, you will be stronger for it, and you will be more resilient so that you can handle these things going forward if ever they come up. But at first, it's so important to take one day at a time, baby steps. That's all you can do is control your steps. Okay. And take one day at a time. And that was very meaningful for her. She agreed, and we stayed in touch. And she said, because of that conversation we had, it gave her the strength that she needed to go on. And she tells other people the same thing now. Without my help, that she doesn't know where she would have been now, because her life was in so much chaos at the time. So those little moments like that really are meaningful to me. And when I do community events and I see individuals, the light just goes on. And events like this right here that we're doing is very meaningful and satisfying, because there's a lot of misunderstandings about what FEMA does and what the mission is. And it's so nice to empower individuals so that they know what to do and know what's possible and get the support they need. And so that's very meaningful for me, especially to see that my community is getting the information they need, the messaging, the resources. That's very satisfying.
Well, thank you so much for all of the support that you've provided to our communities thus far. We need more people like you, and it's good to know that you're out there. I am grateful that there are people like you making our community safe.
Thank you. And I'm thankful for this opportunity.
Well, I don't see any more questions. Do you have any last tips or final messages that you'd like to share with our audience?
First off, I'd like to say again, one day at a time. That applies to life in general. One step at a time, one day at a time. And get more involved with emergency management. Emergency management is not just about interpreting or about, one other thing, but it's about social work, volunteering, mental health, you name it. And it's important to get involved. We also encourage taking care of your pets and having a plan for them. Whether it's a snake, a rabbit, a dog, look at how you can prepare for them in case of an emergency. And we have all the resources at ready.gov, all the information that you need. Also, readykids.gov for children. And you download our FEMA app on your devices. It's a very nice app. I worked with the app team to make sure that we add captioning information and that it's visual. The FEMA app is a very nice resource. You put in your name, your zip code in the app, and it will inform you if there's a disaster in your area. And if there's a disaster recovery centers established, they're every 5 miles, 10 miles, 15 miles from your home, they'll let you know where it's at. And you can add up to 4 or 5 other locations as well. So if you have family in, say, DC or Chicago, Texas, Florida, Alaska, you can add their zip codes and it will tell you where the centers are at. So the app is very accessible, and we strive to make it more accessible for everyone. So download the app, and we have a YouTube library at FEMA.gov. You just type in FEMA on the YouTube search bar, and there's about 75 different videos. Most of those are with me in there. I'm not going to brag, but I'm on there, most of them. And it covers a wide range of topics, most of them about emergency management, the services we provide, how to prepare yourself. It's all there. Just get more involved and speak up with your community leaders. Let them know that, hey, I'd like to be involved in the emergency plans. How can I help? And if you notice any gaps, offer solutions. Please don't just provide them with problems. Come with solutions as well, and help them to help you. I could go on actually, but those are some of the high points.
There is a lot of essential information that the community really needs to be aware of. So thank you. Thank you for your time. Also, I will share that accessible playlist from YouTube. Of course, anybody who's joining us today, feel free to contact Aaron if you have any further questions. You can also reach out to the Arizona Commission for the Deaf and the Hard of Hearing. If you have any ideas about how to be involved in disaster response or ideas about how ACDHH can be more supportive or more involved, if you have resources that we can add to our webpage, please feel free to give us that feedback. We're happy to add anything and everything that will help our communities. So Aaron, thank you for your time. Everyone watching, thank you for joining us, and have a great day and be safe.
And I want to thank my interpreters for being patient with me. I tried to make sure I wasn't going too fast, but thank you so much for your hard work. And I want to thank the captionist as well, the cart provider. Thank you.
Excellent. Thanks so much, Aaron. Have a great day. Take care, everyone. Have a good day.